Hi, my name is Chelsea Powell, and I'm doing validation on NG tube placement and removal. I've already checked my physician's orders and made sure that my patient does have an order for an NG tube placement. I provided privacy, and I washed my hands before coming in, and I gathered my supplies and set them on the bedside table. Hi, can you tell me your name and date of birth, please? Hi, Mr. Bensick. My name's Chelsea, and I'm a nursing student. We have a doctor's order to place an NG tube. This is a tube that's going to go in your nose and down to your stomach to help with feeding. It'll be a little uncomfortable, but I have some water here that should help swallow. If you have any discomfort while I'm putting it in, if you could just kind of move your hand but don't try to talk, that would be best. If you have any questions before I begin, I'm just going to move the bed up to a comfortable working height and set your head up right too. Your bed brake is on, which is a good thing, and you have your call lights right here on the side of the bed. Have you been swallowing okay? I'm just checking for gag reflex in the patient. And I'm also going to see which nostril is most clear. Can you blow out of your nose? Okay, it looks like your right nostril is most clear. So I'm going to go ahead and put some clean gloves on, okay? I'm going to move your gown out of the way, and we also have a towel I'm going to place over your chest just to make sure we don't have any messes, alright? But before we do that too much, I'm going to measure how long we need to put the NG tube in, okay? So I'm just going to measure from the point of your nose down to your ear and then over down to the xiphoid process. So it looks like we have to go this far. I'm going to put some tape there so I know when we've reached the spot. And I'm also going to prepare my tape to help hold it on your nose once we get it in place. And I'm going to go ahead and measure in centimeters how long we marked it at, just so we know for further reference how far. So it looks like it's in 36 centimeters. I'm going to go ahead and lubricate with my mannequin approved lubricant. The first few inches, and this will just make it easier. I have this cup of water here for you, so as you're swallowing, if you need help, we have the cup of water, so that will help you swallow. I'm going to put this down over your chest. Alright, and this is going to go in your right nostril. I'm going to have you tilt your head back a little bit. And once it gets to the back of your nose, I'm going to have you tilt your head down and start swallowing, okay? So here we go. Just take a deep breath. You're doing good. Okay, now tilt your head down and swallow. Keep swallowing. Almost there. Almost there. Perfect. Okay, keep swallowing. You need some water. Just going to check the back of your throat to make sure it's not caught back there. Good, it looks good. I'm going to secure it to your nose temporarily. My tape will stay for me. There we go. And then you'll have to go down to chest x-ray in a little while to verify it. But before we do that, I'm going to withdraw some of the content and check for pH. And I'm also going to listen for a gastric bubble, okay? gastric bubble. We'll do that first. Okay, so I heard the gastric bubble, which is a good sign. And now I'm just going to withdraw some of the content. Probably around 20 mils, no more than that. Don't need much. And then we'll get pH strips and we'll verify that it's acidic to make sure it's in your stomach. I'm going to go ahead and pin this to your gown now. And we'll make sure that order is in the chest x-ray, and they'll come up and they'll verify it. And then once they verify it, we can go ahead and put your food through the NG tube or medications, whatever we need for you to swallow. My tape job just doesn't work. Okay, so they also want us to validate removal. So since with a normal patient you would have to wait for chest x-ray to come verify that it was to keep using it and make sure that's actually in the stomach. But since for validation's sake they want us to go ahead and just do removal also, I'm going to pretend like this is my same patient, and I'm just going to start over with this patient for the removal of the NG tube. Alright, Mr. Sick. Well, your call light is right here in reach, and I will be back and check on you in a little bit, okay? So, this is take 2. This is removal of the NG. I've checked my physician's orders, and I have an order for this patient to have removal of the NG tube. I've provided privacy and washed my hands before I came in, and I have my supplies gathered. Can you tell me your name and date of birth? Alright, Mr. Sick, we have an order to go ahead and remove your NG tube, so I'm just going to get some clean gloves on and we'll get that out, okay? And taking the NG tube out is not as uncomfortable as putting one in is, so it won't be very painful and it'll be really quick. Do you have any questions before I start? Alright. I'm going to go ahead and just put this towel over it. And if the NG tube was connected to any type of tube feed, we would turn that machine off and disconnect it and make sure there wasn't anything running, and we would flush the tube, or if there had been any meds or anything in it, we would flush the tube and make sure that everything's down, usually with like 20 mils of water. So since the tube is clear, I'm going to go ahead and just remove this tape that's holding it in place. And I'm going to have you take a deep breath, and I'm just going to pull out, okay? Take a deep breath. 1, 2, 3. Take a deep breath. There we go. Alrighty. That was it. Not too painful, huh? Okay, well, if you need anything right now, now that you don't have the NG tube, your head can go flat. When you had the NG tube, you had to keep your head at least a 30-degree angle. And since you don't have that anymore, you can lay back down on your back again if you'd like. But your call light's right here if you need anything else, and I'll clean up my mess. But before I leave, is there anything I can get you? Alright. And then with both placement and removal of the NG tube, I would document the placement and removal separately and how the patient handled it. With placement, I would have documented the time and date when I placed it, how the patient handled it, and then any secretions, like the pH of the stomach content that I removed. Sorry. But yeah, that's it.